My knees were really painful a couple of years ago. I was scared to exercise before I found you. Now here I am with good, strong knees and no pain anymore. Do you struggle with knee pain? Maybe you've been diagnosed with knee osteoarthritis.
As physios who work with adults 55 plus, we see this condition a lot, and we know that it can be tough to manage. But we also know that there's a lot that you can do about it.
Hey, it's Jack and Gaz, two of the physios here at Be Mobile. And in this video, we're going to be taking you through how you can manage your osteoarthritis. We're going to be telling you all about the condition, what treatments are effective and what treatments to avoid, and then show you some effective exercises that you can do as a part of your workout regime. So let's dive into it.
Knee osteoarthritis affects 1 in 5 adults over 45 in Australia. So it's not surprising that many members of the Be Mobile community experience this condition. Knee osteoarthritis is often characterised by an increase in pain, stiffness, potential swelling around the joint, as well as potential feelings of instability. It's important to remember, however, that knee osteoarthritis is an inflammatory condition that affects the whole joint and not just the cartilage. It can affect the bone, and connective tissue, the meniscus, and even the muscles surrounding the joint.
The symptoms of knee OA can be frustrating and debilitating, so we understand that it sucks when it does get in the way of your daily tasks. So obviously people will complain of having pain in their knee joints, especially when doing tasks such as climbing the stairs, maybe squatting down to do something, maybe when you're running or trying to go on a hike in the bush. There might also be some restriction in the range of movement, and that can be more chronically. So people can complain of not being able to pull their heel back and get into that nice flexion position, which once again can restrict you when you're doing sit to stands from a chair or maybe getting up from the floor. Often of a morning, people feel that stiffness as well in their knee, and that's often eased with movement or such things as a hot shower. And then swelling can also be something that people experience from knee osteoarthritis, where the knee tends to swell out a little bit, and that can potentially restrict the range of movement with that puffiness. And lastly, you might also get a feeling of joint instability, which can be frustrating when you're trying to do things like go for a hike or just exercise generally when you're doing strength training.
So what about scans? Let me tell you a common story. A patient with persistent pain or stiffness in their knee goes to see their GP. They may get sent for an X-ray or an MRI, which comes back with findings such as degeneration, cartilage thinning, or loss of joint space. Your GP or another health professional may have even described it as wear and tear. Now, this approach often oversimplifies the condition and doesn't tell the whole story. Words and descriptions such as degeneration are often unnecessarily scary and are often better described as age-related changes. Check out this X-ray. Now, this knee has some obvious signs of OA. We have some loss of joint space and some significant cartilage thinning. Now, one would assume that the person with this X-ray would be experiencing a lot of pain. However, we know that the signs on an X-ray correlate very poorly with pain. In fact, up to 43% of people aged over 40 have signs of OA on an MRI, but no pain at all. So remember, scans are not the whole story.
So it's clear that joint changes are not the whole story. This should be viewed as a whole person condition, and there are many contributing factors. We've got biological factors, so joint changes, obesity, previous injury or trauma, maybe doing too much too soon. We've got psychological factors, so that's self-efficacy, maybe someone's self-belief around their health and their mental health. And we've also got social factors, so that's relationships that we're involved in, obviously our economic status, and also the culture with which we are in. So there's a lot of factors contributing to knee pain, not just the joint changes. Okay, before we get into the best treatments for knee osteoarthritis, let's go through some strategies you might like to use to reduce pain and stiffness throughout your day.
A terrific strategy is simply a warm-up.
Yep.
Now, we know a lot of people with knee OA get pain first thing in the morning after long periods of static postures.
So I've just got up, Gaz.
Did you?
Yep.
Okay, it's a bit late in the day, but that's all right. So what can we do for a warm-up, Jack? You're sitting in your chair or you're on the edge of your bed?
Easy. Just
Bit of
start
a march
marching.
on the spot.
Yeah, I think that's a great strategy, but as well, you'd probably be in a higher bed than I am here. But also just holding your knee and doing some bends, I think, is a great way because you're not weight bearing at all. It's probably going to be fairly pain-free, just doing what you can tolerate there.
Yeah, for sure. You could do something similar in standing if you want, bit of a march or some standing knee bends as well. Holding on to something if you need. We do know that feelings of instability can be one of those symptoms of knee OA, so by all means, do some things for your balance.
And I think having a hot shower, a lot of our members and clients say that having a hot shower is really important for warming their knees up.
Yeah, that's right. So as we said, often periods of inactivity or static postures can be one of those things which can contribute to symptoms.
Yeah.
So simply breaking up those long periods of static postures and sitting can be an excellent strategy as well.
Especially if you're at work and you're sitting down a lot during the day, just get up from the computer, take that next call, go for a walk outside, maybe at lunchtime, go for a walk, try to move more often.
For sure. Another strategy is something like a knee sleeve. So this is just a neoprene wrap. Oh, don't you want to know?
Pocket.
It's a neoprene wrap that goes around the joint and just provides a bit of warmth, a bit of comfort, and a bit of confidence. But it is important to note that a knee sleeve such as this doesn't provide any real structural support to the knee, does it, Jack?
No, so we're not, it's not like a full-on brace, as you said, it's just providing a bit of comfort around the knee, a bit of warmth. Now, something else which might help the joints throughout the day for pain management and stiffness is exercise.
Yep.
Now, we're going to get into some strength exercise you can do at home, but any exercise is going to be great, whether that's strength training, walking, running, swimming, cycling. This is great for pain management, and as long as it's tolerable, we think it's a great strategy.
Absolutely, and if it's something that you enjoy, even better. It's important to be aware that there are a lot of treatments for knee osteoarthritis.
That's right, Gaz, and they are not all equal, are they?
No, they're not.
So we're going to refer to the Royal Australian College of General Practitioner Knee Osteoarthritis Guidelines. And these are really great because they bring together all of the evidence surrounding knee OA and tell us what to do and what not to do when it comes to treatment.
Let's start with what is recommended against. And the first thing we'll talk about are knee arthroscopies. Now, these are surgeries often known as clean-outs, debridements, or cartilage repairs. Now, the evidence shows that these forms of surgery perform no better than non-surgical options, and there is inherent risk associated with surgery.
That is exactly right. Now, the guidelines also recommend against taking supplements such as turmeric, fish oil, or glucosamine. And other therapies they recommend against are things like shockwave, ultrasound therapy, knee OA specific shoes.
They also recommend against things like acupuncture and manipulations. Though they can give you some short-term relief, they provide no long-term benefit, and there's an opportunity cost performing these treatments when you can be doing something that is more effective.
Okay, let's talk about what the guidelines recommend for treatment. Now, they focus on 3 areas, and that is education, weight management, and exercise. Now, when it comes to education, that is exactly what you are doing right now. You're informing yourself more and more about the condition of knee osteoarthritis so that you can improve upon it.
That's right. As you said, Jack, weight management is recommended. If you are carrying extra weight, even losing just a small amount can have a massive benefit in terms of your symptoms. It can reduce the load on the knee, but also reduce some of the inflammation that's associated with the condition. Now, we know that losing weight can be challenging, so if you need some help, make sure you speak to a dietitian.
Okay, Gaz, let's talk about the big one, and that is exercise. They strongly recommend doing exercise, but in particular, land-based exercise. Things like strength training, cycling, walking, versus things like aquarobics or swimming.
That's right. Now, you may be thinking that these land-based exercises may contribute to the wear and tear of the joint. However, we know that this is now an outdated concept. Our bodies are adaptable structures, and in fact, the compression and the load that we subject them to during these land-based exercises help to keep the joint healthy.
Yeah, so Gaz, they enjoy the compression and the load, which is why we like to say wear and repair.
Correct.
And mate, we have so many stories from our Be Mobile members of how they started with knee osteoarthritis, but now since doing strength training, walking, cycling, all these land-based exercises, they are now feeling these massive improvements. So let's hear from Valerie. My knees were really painful a couple of years ago. I was scared to exercise before I found you. Now here I am with good, strong knees and no pain anymore.
Charlie also told us this. I had OA in my right knee with lots of pain, clunking and instability. I gradually increased the weight of my squats. Now I'm able to do lunges with weights and have greatly improved balance on my right side. Similar instability to my left. I'm also doing stairs 2 at a time. I'm pain-free and have a lot less clunks. I rarely need medication now for my knee.
So those are some great stories and examples of people who have been doing land-based exercise and have improved their knee osteoarthritis. Now, before we go into our 5 knee osteoarthritis exercises, we're going to talk a little bit about knee replacements.
Now, a knee replacement is certainly an option, but it should never be a first option. In fact, a knee replacement should effectively be a last resort.
Yeah, because there are a lot of risks associated with actually getting the surgery, aren't there?
That's right. And there's also a lot of things which contribute to the condition. And hence, replacing just the knee does not fix all of these things.
Yeah, so get this stat, 1 in 5 people who actually get their knee replacement don't end up with better results. So they don't actually have better pain or function. And it's really important to remember that you should try to be exhausting the education, the weight management, and the exercise that you have at your disposal. These are your kind of first line treatments. And as Gaz said before, making sure you're consulting your doctor and your physio as a last resort before getting a replacement. All right, let's now go through 5 key exercises that you can do to strengthen your knees if you have knee osteoarthritis. Now, it's important to note that you might have pain during these exercises, but as long as it is tolerable, you're okay to continue.
That's right. And on that point as well, if you need to modify the exercises in any way, and we'll give you some examples of how to do that, then we'd encourage you to do so in order to keep things tolerable.
Okay, let's get into the first exercise, and that is going to be a squat or a sit to stand. Gaz, walk me through it.
Absolutely. So we're going to start with a sit to stand, perhaps the easier and more tolerable option. So if your knees are a bit more sensitive, then this might be a good place to start. All you need is a chair, a bed, a surface, a box. Sit to stand is, as the name suggests, going from that sitting position there to standing. If you can do so, you can go like Jack without using your hands, and that's really going to target the muscles and the structures around the knee without any extra assistance. How's that feel for you, Jack?
Yeah, it feels good, and I might like to make that easier by actually decreasing the depth by adding a pillow. So I'm actually standing from a higher position now. Oh yeah, and that's already easier.
Absolutely. Yeah, so we've reduced the range of motion. Exactly. You can use your hands to help your knees out a little bit if necessary. And so obviously the knees, the structures, the joints all around the knee there are really doing quite a bit of work, and then hopefully get a bit more strong as a result.
Yes. Now you can play around with foot position. You can see here, like some people like to stand really narrow like this, and that's fine for them. Some people prefer a wider stance. Once again, you might turn your toes out. You might face your toes more forward. That's important as well. Gaz, what about torso angle?
Absolutely. So if you want to, you can bend your torso a bit further forwards on the way up, and that can help with your balance and your comfort during the movement as well.
Yeah, that's completely fine.
So that's the sit to stand, Jack. And we talked a bit about range of motion there, in that we can reduce the range of motion to make it a bit more tolerable. But if we want to make it a bit more challenging, perhaps we can increase the range of motion, and we can do an exercise such as a squat. So talk me through the squat, Jack.
Yeah, let's run through the squat. So the premise of the squat is to get your bottom towards the floor, nice and simple. You're playing around with all the same principles. So foot width, okay, shoulder width apart, more narrow, toes turned out, maybe toes turned in. You've got to find what is right for you and what's tolerable for you. And we talked about torso angle before, Gaz. You can get your torso more forward, as you can see Gaz doing there. Okay, or you could stay more upright. That's going to be completely up to you. And we can work on depth as well. Okay, so some people might start with a shallow squat if you're progressing from a sit to stand, and then over time work on more and more depth. Any other pointers there, Gaz?
Not at all. I think in terms of the modifications for the squat or the sit to stand, the squat in particular, the best modifications for you are going to be things that make it more tolerable or allow you to increase your depth. So that's with regard to those stance, the foot position, etc.
Now, if you need to hold weight for either the sit to stand or the squat, you can grab a weight. You can even wear a backpack with some books in it.
That's right.
You could grab a weight, hold it on the front, and do the movement exactly the same, but we're adding weight. And that's just a way to make it more and more challenging.
Absolutely, because ultimately we're trying to increase the capacity of our joints and our knees in particular in this case, so that they can do more and they can handle more.
Okay, let's go through exercise number 2, and that is the glute bridge. This is one where we're going to be lying on the ground.
Yep. So lying on the ground or perhaps lying on the bed if you're not comfortable getting on and off the floor. So you're going to start on your back. Now the glute bridge, a great exercise for strengthening the muscles around the knee, particularly the ones at the back, but then also your glutes, so a bit higher than the knee as well, which can help to offload and aid the knee in terms of what it's able to do. So you're gonna lie on your back, feet on the ground, tucked up towards your bottom, pushing your feet into the ground to lift your pelvis up off the ground as high as possible.
Yeah, and I can feel that right in the back of my legs and my hamstrings, but also in my bottom there, a little bit even in my calf muscles.
Absolutely, and so you can modify this, you can change things around a little bit. You might want to pop your knees a bit further out if you do have a reduced range of motion in your knee, which we talked about earlier, and you simply can't tuck your feet as far back towards your bottom. You can do a similar movement, but with a bit less knee bend.
Okay, let's raise it up now.
Let's raise it up. So if that's a bit too easy for you and you're not quite feeling the challenge, or you feel as though you have a bit more capacity to do more, you can do an elevated glute bridge. So you can use a chair. It doesn't have to be that high necessarily. It could be a step. But otherwise, you're doing the same thing. Your heels are on the surface, pushing into your heels, and again, trying to lift your pelvis up off the ground and trying to achieve a straight line between your shoulders and your knees at the top of the movement.
And once again, we're really working the hamstrings and the back of the leg there, and I can really feel that a lot more in the hamstrings on this variation. It's just a bit more tough than the last one. So that is the glute bridge. Any more tips about that one, Gaz?
Not at all, mate.
Okay.
I hope you're enjoying the exercises and you're finding this video reassuring, knowing that there is heaps that can be done for your OA. Now, if you want to see more educational and exercise content just like this, make sure you subscribe to the channel.
Okay, let's get into our third exercise, and that is the split squat. So we talked about a squat before, Gaz. Now we're going to get into the split squat. It looks kind of like a lunge, except we're not really stepping out.
That's right. Yeah, so it's a unilateral exercise. That's a tongue twister, isn't it, mate?
Unilateral.
So it's only really working one side at a time, but talk me through it, mate. I'll demonstrate.
Yeah, so Gaz is dropping his back knee to the ground. Now, a lot of people are quite fearful over this movement when they have knee osteoarthritis, but what you can start with is a really small one, and it could even be smaller than that, just like your squat. It could be a really shallow one, getting your knee used to that bending movement, because you're going to have to get up off the ground at some point in our life, aren't we? So you might as well practice it.
Absolutely. How can we modify this? We can change our stance width. Wow.
That's a tongue twister.
Twister, mate. So you can do a bigger step forwards if you wish, or a narrower again, something that's going to make you feel a bit more comfortable, make things a bit more tolerable.
Yep. Now, definitely use hand support to start with. And guys, grab those two pillows. I think this is a ripper, this one.
Yep.
So if you put them on the ground, step over them, and that can be an aim for you to have. Okay, so you're aiming your knee to try to touch that lightly and come back up.
That's right. You've got a target, and it's a nice, safe target as well. So ultimately, the target should be the floor, but often the floor is quite hard, and if your knees are quite sensitive, you're not going to enjoy that.
We could even take that away, couldn't we? And now he's going even lower. So there's a split squat. Okay.
Absolutely. And obviously the split squat, which I said it's a unilateral exercise, the side that is working is this front leg.
Yep.
Okay, it's often good to do these things on both sides, but if you do want to know which one should be working and where you should be feeling it, it's certainly this front leg.
Okay, great. So that is the split squat. Let's go through now exercise number 4. It's quite simple.
Yep.
You've probably done it in the past, probably a million times, but we think it's effective for working the lower leg muscles, which actually attach up into your knee as well. So it is the heel raise. You've probably done these holding onto your kitchen bench before whilst waiting for the kettle to boil or something like that. So as you can see, Garrick is just lifting his heels off the ground, hence the heel raise. Okay. Now we recommend holding onto a bench because it's not a balance exercise, it's a strength exercise for your lower legs.
That's right. Speaking of strength exercise, if that isn't hard enough, Jack, or if that's too easy rather, what are we doing?
Okay, let's go to a single leg. So if that's too easy, you can of course do a single leg version of the heel raise, and trust me, that will start burning your calf muscles after 10 or so reps, I would say.
Oh yeah.
Okay, nice and simple. Let's get into the 5th and final exercise we recommend doing if you have knee OA.
Yep, okay, it's the step up. Again, a relatively self-explanatory exercise, but one that you might do every day or one that you maybe avoid doing, and hence lies the benefit. So we can also dose it. So we've got a step here. The step up, as the name suggests, is just doing repetitive steps up and down that step there. If you need to, hold on to a rail. Of course, if you're using a stair set, then you may have a rail next to you already.
Yep.
You can progress to reducing that hand support. So you might want to start by holding on, and as you get more confident and stronger, you can reduce that, whether it's a light touch or not holding on at all.
Yeah, great. And you can see I've got a couple of levels on the step here, but to make that easier, you can of course, and maybe you don't have one of these at home, but you could try a smaller step either around your house or in the community, and that's going to make it easier to go up and down. But also, you can actually make it harder. Progress
bit of weight, mate. Yep, absolutely.
Holding
so
a bit
whether
of
it's a
weight.
dumbbell, you might have a backpack at home, chuck some books in it, make it a bit heavier, increase the load, increase the capacity.
Great. So those are 5 exercises you can do to improve your knee weight. And what we're trying to do is mimic everyday movements, okay, and do them in a challenging way so they become easier in the long run.
That's right. So Jack, how much of those exercises should we do?
Great question. So we're going to try to do 10 to 15 repetitions of each exercise and aim for 3 lots of them or 3 sets of them. Try to do them twice a week in line with the physical activity guidelines. All right, let's run through the big takeaways from this video. Knee osteoarthritis is diagnosed based off your symptoms and function, not just your scans.
Second, knee osteoarthritis is not a wear and tear condition. Your joints are not simple mechanical structures like that of a car. Your body wears and repairs.
Now, if you are experiencing pain whilst exercising, this does not necessarily mean you are causing damage. You are exercising a sensitive joint. Just make sure you start at a manageable level and then slowly progress over time.
And lastly, appropriately dosed exercise can make your joint better, not worse. So don't delay, start today.
If you enjoyed this video and you'd like to see more just like it, well then make sure you subscribe to our YouTube channel. Thanks for watching.